Hi, my name is Cameron. This is a demonstrative speech for Dr. Fairchild's CMS 100 class. We're going to demonstrate how to properly initiate an IV into the antecubital fossa, or the AC area, the most commonly used area for an IV. During this speech, we're going to discuss who needs an IV, the supplies needed to start one. We'll go over the steps of how to initiate an IV, and then finally we will do the actual needle stick. Imagine, if you will, you're at the hospital, you're sick, doctor says, gonna start an IV, get some fluids going, and your heart starts racing. And you've got anxiety because all my veins roll and all these other reasons for why you're bad for an IV. Well, your tech comes on in, gets everything going, and does the stick. Something goes wrong. You're not sure because you're not a clinician. Before you know it, there's blood everywhere. It's on the floor, it's on the bed, it's on your clothes, and the tech is scrambling to try to get the bleeding to stop. This is where I walked in. This is an actual scenario that happened while I was working as an ER tech. A big reason that this happens, and we'll go over it, is because the steps were initiated properly. So, without further ado, let's go over who needs an IV. 1, a patient who needs fluids. Any patient who is dehydrated, possibly in trauma, losing blood internally or externally, those people need IVs to replenish that fluid that's been lost. The second reason, and these are in no particular order, medication administration. Any patient who needs diuretics, patients in cardiac arrest, any patient who is in need of pain management. Very popular reason in a hospital to get an IV initiated. Women giving birth, stuff like that. The third reason, and this doesn't really apply to a whole lot of EMS situations, out of hospital providers for paramedics. It depends on your system, to be honest, but the collection of labs. There are some systems in more rural areas where they're further away from a hospital where paramedics are allowed to collect labs. In the area that I happen to live in, that's not a common practice. So let's go over the supplies. We have the supplies sitting here on the bed. Here is our dummy arm to actually do the stick. Here is our IV start kit. Here is our catheter, and this is actually kind of a unique catheter. It depends on whether or not you're supplied by your hospital to have them, but not everybody has these type of catheters. And then we have tubing, and finally we have the actual fluid. Since this is a demonstration, I'm not actually going to waste any of this fluid, so I'm going to verbalize that I'm going to spike the bag and drain it, but I'm not actually going to connect it to the IV and run fluid through a borrowed arm. So, let's finally get this stick done. So the first thing we're going to do, always, whether you are an in-hospital provider or whether you are a paramedic on the streets, you're going to get your orders from somebody. In a hospital that's online medical direction, the doctor's going to verbally tell you face-to-face you're going to start the IV. If you are an out-of-hospital provider, like a paramedic, you're going to use your protocols to know that you need to start an IV. So we're going to check that first. Second, we're going to take our proper BSI, or body substance isolation, which in this case is gloves. And I really should be wearing goggles, but I don't have a pair. So, the third step, we're going to check the fluid. You always want to make sure at the beginning of your shift that you do not have any expired fluid. Make sure it's not cloudy or hazy or starting to look thick. After that, we are going to check our patient and select the proper sized gauged catheter. Pink is always a 20 gauge catheter. It's the most commonly chosen size. Green is 18, blue is 22, so on and so forth. After that, we're going to choose our tubing, whether we're going to do a micro drip or a macro drip. That all depends depends on what you're administering. In most cases where we're just going to give fluid, we're going to use a macro drip. Finally, we would, after that, we would connect the tubing to the bag, and then we would drain it for a little bit, let the fluid run through the tube so there's no air bubbles in it. After that, what I like to do is make sure I'm all ready. Open up my start kit, and I've got my tape. So I try to find a place that's easily accessible, and I just rip off a few pieces so that I am not trying to get tape with one hand and a patient in dire need of an IV line. So now that we got that, we're going to use our constricting band, not a tourniquet, and we are going to, typically you want to go a couple inches, 2 to 3, above the site where you want to do your stick. So this is technically this arm's antecubital fossa, the AC area right here. So just to keep it out of the way, we are going to ramp up here. And then after that, let gravity help us. We're going to palpate our veins. So since this is a dummy and it's all set up for us to have a nice stick, he's got nice good veins. Find the place we want to go. Go back into our start kit. This is your Tegaderm. It's just nice to kind of have it ready for you. And then we're going to get our alcohol prep pad, and we're going to cleanse the site. Now you can touch the site after you've cleaned it, but if you touch it, you got to clean it again. So our site's all cleansed. Pop open our catheter. And there is a step in this that is actually eliminated by this catheter because this is a rather innovative butterfly catheter. So this next part is paramount. When you are performing this stick, and if you want to come in here and get a closer look, what's going to end up happening is on real skin, you're going to want to pull traction as hard as you can because veins roll. Veins are pieces of flesh suspended in more flesh with fluid running through them and around them. So they roll if you're not giving good traction. So good traction is pulling the skin nice and taut so that this vein does not move and you get a good stick on the first try. So we've cleansed our site. Grab beneath the elbow. And then what I like to do is I like to choose visually where I want to go and start the needle just below that. So at an angle, we're going to perform the puncture. Now normally, if you were using a straight catheter, so we'd get our flash in here, just in the center of the butterfly, just a little bit of blood flashing in there. You never want to release your catheter, take your hands off of it, but the great thing about this is you can remove the needle and not have to occlude the vein. If you're using a straight catheter, you always have to occlude the vein, which is applying pressure just above where the catheter ends, so that blood does not come out of the back of the port. But with these butterfly catheters that are newer, you don't have to do that, so that you don't have to worry about that. So after you get that, you would connect your fluid here to this port to drain it, and then after that, with these, you actually want to, so that you don't have any fluid running from the other port, this extra port just stops it. And then we're going to use our Tegaderm. Give us a nice window and seal it so that it can't go anywhere. And then after that, we're going to use the tape that we set aside, and we're going to set this up These have clips on them actually, so if we're not actually going to run fluid, if we're just going to have an IV for access for pain management or anything like that, we can clip this shut so that blood does not back up into the tubing. And then we're just going to tape down here and seal it. And if you're really kind of anal about everything, you can do it one more time just to make sure there are no loose ends. And then after that, and securing it, we would adjust our flow rate. It used to be just TKO, to keep the vein open. That's not really used anymore. Now most medical directors want some sort of number at a drip rate. For this, if we were just to keep the vein open, we would do it 6 to 10 drips. 6 to 10 drips in a minute. It's not really a whole lot, but it's just enough to kind of keep the vein open and ready to give medication. If we were giving the fluid, we could open that up. So after that, our patient's all good. We have a good patent IV line. We would document it, do our run report to the hospital en route, and tell them that we have a 20 gauge IV in the right AC. So the scenario I gave in the beginning, that was an actual scenario that I saw, and the patient was completely freaked out, didn't know what to do. So I had to help my coworker alleviate the situation. The situation could have been avoided completely had these steps were followed properly. So in this speech we've gone over who needs an IV, the supplies needed to start an IV, and the proper steps, and then we've demonstrated those steps right here.